Welcome everyone to Mayo Clinic Q&A. I'm Dee Dee Seepin. In an effort to help slow the spread of COVID-19, Mayo Clinic has introduced a tracking tool on mayoclinic.org that features the latest COVID-19 data from every county in all 50 states and Washington, D.C. The interactive map is part of Mayo Clinic's COVID-19 online resource center, offering insight on how to assess risk and plan accordingly. Here to discuss is Dr. Henry Ting. Dr. Ting is a cardiologist, health services researcher, and educator at Mayo Clinic. Welcome to the program, Dr. Ting.
Thank you very much, Stevie. A pleasure to be here.
Can you explain why a tool like this is important for the public?
I think a tool like this can provide very detailed information for the public in communities where they live and work about COVID cases, about new cases and total cases. So they can make some decisions about how safe it is and whether they want to travel to other communities.
And why is knowledge of what's happening at the local level important?
Knowledge at the local level, I think it's probably more important than knowledge of just the state or the country when you're looking at cases or hospitalizations. Because when you look at it, even a state like Minnesota, and you look at Hennepin County versus Olmsted County, the state is quite heterogeneous, and there are large differences between the number of cases and the rise and fall of cases across the different counties. So this really gives you a level of granularity. So in the county, in the community where you live and work, you can see what's happening with COVID cases, whether they're increasing, falling, or staying plateaued. And we're glad to report that because of the great work by all of our staff and communities in Olmsted County and southeast Minnesota, that the number of COVID cases remains quite low, and we've been effective at bending that curve, if you will.
Can you explain how exactly this tool works?
The tool actually starts with what we call a data aggregator. So we're pulling data from multiple sources that tell us about COVID cases and test results across the United States. So places like the State Departments of Health, COVID Tracker, the Johns Hopkins website, we're pulling in all these external data sources, creating a single data platform. And from that data platform, then we're reporting on what's going on in individual counties and communities. We're actually also using it to predict future cases. In fact, for the last 4 to 4 months, we've been using this data platform to create a predictive model that can predict the future number of cases in these communities and counties, as well as predict the number of hospitalizations. And this has been particularly useful for our 20 hospitals at Mayo Clinic across 4 geographic states, because we've used this information to help us to prepare and plan and to mobilize our resources to the places and hospitals where we need them the most. Things like ventilators, medications, staffing and nurses and doctors. We are now releasing this website to the public to give the public information about cases now and in the future.
Dr. Ting, are there any features that you'd like to highlight?
Front page of the website is a COVID map that shows you the number of cases at the county level, new cases and total cases, and we'll be soon adding features that show you a forecast of what you can expect in terms of future cases in the coming weeks. I think that'd be very useful for the public to know about. But more than that, we're offering links within the website to information and innovations about COVID. As we all know, COVID's been with us for over 6 months now, and we continue to make discoveries and innovations about COVID diagnoses, testing, vaccines, other treatments. This information sometimes can be conflicting and difficult to understand and confusing in the media. So our Mayo Clinic clinicians and experts are reviewing this information and providing Mayo vetted information onto the links so that the public can see what are the innovations and discoveries that are relevant and meaningful with regards to diagnosis, testing, treatments, and vaccine for COVID.
How do you track all of the data in all 50 states?
It does require us to pull data from multiple external sources and to curate that data, because sometimes the data is not accurate and sometimes the data is lagging. But because we have multiple sources of external data, we've been curating this information for the last 6 months. we now have a very good data aggregator and platform that tells us what is going on across all 50 states as well as at individual county level. In fact, we're actually tracking this information at the world level. So we know in different countries what's going on with COVID cases as well.
Or what do you hope the public will do with all of this information that they find?
We've been recommending safety practices, and I think if we do the 4 safety practices, including masking, physical distancing, hand hygiene, and environmental surface cleaning, I think those are going to be very effective in stopping the spread and growth of COVID. So I think with this information in the communities, you can begin to see which communities have done that well and continue to sustain those behaviors. We're hoping that with the holidays approaching and with COVID entering its 8th and 9th month, that the public can look at this information, one, to judge how safe their own community is, and if they need to travel to visit a relative or a loved one or a friend in another community, they can look at the information about that other community and decide whether it is safe and they can take on the risk to travel there to see their friend or relative.
Can you talk about some other COVID-19 resources that are available from Mayo Clinic?
As you know, Mayo Clinic is a forefront leader in some of the vaccine research as well as treatments for COVID, including convalescent plasma, as well as Mayo Clinic continues to review all the relevant medical literature and discoveries and tries to make it applicable and relevant. And what does this mean for our providers as well as for our public? And we're providing this information into the website so that the public can easily find specific information about the reopening of schools and what does that mean, or the vaccines and the safety and efficacy of vaccines and how they be distributed. So all this information will be available within links of the COVID tracker.
Is there anything else that you wanted to add?
We've been working on this COVID tracker and using this model for nearly 4 months at Mayo Clinic. This has been used to help our hospital practice leadership predict and prepare for patients with COVID who need to be hospitalized at our 20 hospitals in 4 geographic states. The model's been incredibly accurate. We've learned over the last 4 months that it actually predicts the surges in cases as well as the declines and plateaus. So we decided that given how accurate it's performed, that it would be meaningful and relevant for the public to have this information. And that's what we hope, that this will be something useful and the public can make use of it, including the links about information about COVID and innovations and discoveries.
Well, thank you so much, Dr. Ting, for joining us. We've been asking him all about the new tracking tool, the COVID tracking tool available on mayoclinic.org. Thanks so much for being with us today, Dr. Ting.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu. Thanks for listening, and be well.